Hi, everyone, and welcome back to the Home Care You Say Updates podcast. My name is Bliss Pointer, and I'm so excited to be back with you all this week. If you can't tell, I'm feeling a little bit under the weather, but advocacy waits for no one. So we are going to get started with these updates. Today, we are going to start with South Carolina, who just completed an amazing Advocacy Day. I returned back on Wednesday. The Advocacy Day took place this past Tuesday of February 24th, and it was just such an amazing event. We had an opportunity to meet with about 50 lawmakers, which is really great, along with the governor of South Carolina, Governor McMaster's, and that was an absolutely successful day. Just such a great opportunity to see families, caregivers, clients, providers, just everyone come together to walk the halls in Columbia. So I do have a clip for you guys to listen to. This is a clip of just all of the advocates being recognized from the House floor. This is such a great thing that happens on Advocacy Day when legislators get to recognize us in the gallery during session. So insert clip here.
But ladies and gentlemen, if you're here in the balcony with Hearts for Home Care, or the South Carolina Home Care and Hospice Association, or the Home Care Association of America, or you're affiliated with that group at all, please stand. Mr. President, I am honored today to recognize these folks, the Hearts for Home Care, South Carolina Home Care and Hospice Association, the Home Care Association of America, which is our South Carolina chapter, and the many dedicated home health care and hospice providers, families and caregivers that are gathered here today. Their unwavering advocacy and commitment to serve South Carolina's most vulnerable and medically fragile citizens make a meaningful difference for families across our great state. I also want to take a moment to honor the hardworking frontline healthcare workers and advocates who provide compassionate, high-quality health care every day. Your dedication, your expertise, your kindness improved countless lives, and we are truly grateful for your service. I have personally been involved with this group with constituents that I serve, and I've seen firsthand the great work that you do. And the South Carolina Senate appreciates that so much, and we would like to honor and recognize you today. Does anyone else wish to say anything? Well, thank you all for being here, but more importantly, thank you for what you do for our constituents. And anything we can do to help you, please let us know. I know this group has been largely charged by Melissa Altman for many, many years. We appreciate all her hard work. And assembling the team, and every member of the team is a valuable member. So thank you for being here. Appreciate it, and God bless you all.
What a wonderful message from South Carolina. So now moving to the federal update, something that we've been talking about with fraud in the past couple of podcasts and talking about CMS, just wanted to give you a quick update. Also, you guys probably already know this. You've been looking at the headlines. You know what's going on, but just a little bit of an update. So under CMS Administrator Dr. Oz, the Center for Medicare and Medicaid Services is ramping up program integrity enforcement efforts. While fraud prevention is always important, increased federal oversight often brings heightened pressure on state Medicaid budgets. And when Medicaid funding feels pressure, home and community-based service feels it just as much. We've talked about that before and how it trickles down. So this is why sustainable reimbursement matters, and when rates do not reflect the real cost of care, medically fragile children, adults, and seniors are the ones at risk, right? So now more than ever, policymakers need to hear directly from providers, caregivers, clients, people like you. You need to go to your state legislators and talk to them before we have situations arise, so they know what's going on. They know how home and community-based services are affecting our communities. That's the most important thing. And you see headlines. A lot of you have been watching what's going on in Minnesota. They just announced that some funding is not going to go to them. And that brings a lot of concern. That brings concern to other states that predict that it might come their way next. So as much as, that's a lot to get into, I will give you guys the best updates I can, and I can't I can't pressure enough how important it is to get into the legislators' offices before situations arise. So they have the education, they know how important it is, they know who you are, that you have that connection with them. So when you come when there is a crisis, it's not a surprise. They already have the educational materials, they know what's going on, and they know why you're there. So just another note for you guys, but I appreciate all the efforts so far, and I will keep you updated on all these headlines and information. Moving to New Jersey. New Jersey is preparing for Governor Shirley's budget address on March 10th. We are watching closely to see whether Medicaid funding increases for private duty nursing and personal care assistant services. And we're looking to see if that's included in that budget. So for those that are interested, mark your calendars for March 10th. Typically, these addresses are sometimes live streamed. I'm not quite sure 100% if hers will be, but definitely something to watch. I enjoy watching them. You hear a lot about what the governor is kind of prioritizing and the things they talk about. Budgets can be kind of all-encompassing. They have a lot in them, and not everything relates to one another, obviously, because there's a lot of things that need funding from the state. So, even if you're not listening for anything home care related, or if you are, it's definitely something to listen into because they'll typically target the things that are their priorities. So, talking about that, how are advocates engaging in this situation? We've had different things. This is kind of the season of governors and Department of Health and Human Services giving their budgets and then presenting them to the legislatures who would then produce their budget. So what things can you do as an advocate to kind of support these things? There's letter writing campaigns. You can write a letter to your legislator. There's providing community testimonies. You can even give a testimony at the legislature as well. That's something that some people do. Typically, you have to have a reason or something you're there to talk about, typically following along with the bill or something that's going into the budget. And just participating in meetings. You hear us talk about a lot of these legislator meetings happening even outside of advocacy days, but that's something that's really influential in these budget discussions. So keep an eye out for those opportunities, y'all. Alrighty, moving to Pennsylvania, Governor Shapiro's proposed 2027 budget, as we discussed before, did not include an investment in home care, but that is where advocacy is now pivoting to the legislature. A lot of these increases that get discussed and then implemented are brought into the fold during these legislative budget discussions. So that's why advocacy is so important right now, and these home care check-ins and meetings with legislators that are taking place in Pennsylvania are so crucial to the advocacy efforts there. So again, as we were talking about before, this is a great opportunity to get involved, great opportunity to advocate. Pennsylvania is one of those states that we haven't had an increase in a long time, and that's very important to keep people, up to date with the times, and especially with inflation and things like that weighing on people's minds. Also, keep in mind, Pennsylvania Home Care Association Advocacy Day is March 24th. Feels like it shouldn't be close, but it is almost here. Next week is March. So please keep an eye out. I know for a fact there are a lot of advocates registered. I think a record already. So I really look forward to seeing all the great advocacy that'll take place on the 24th. Moving to the state of Missouri, we don't get to talk about Missouri a lot, but I definitely wanted to highlight them today. Missouri's proposed 2027 budget maintains flat Medicaid funding for private duty nursing services. So what that means is no increase, no inflationary, nothing. It stays the way it has been. That means advocates are really getting into their meetings in Missouri as well. Right now I have 13 meetings with lawmakers have taken place, but I'm sure plenty more have also happened that I don't have on my record, and it includes Senate appropriations chairs and budget chairs in the legislature in Missouri. So these are very influential legislators that these advocates are meeting with to try and hopefully get an increase into the budget for 2027. I wanted to say this year, y'all. I feel like we're already in 2027 as much as we talk about it. So another great opportunity if you're an advocate in Missouri to get active. All right, moving down as far south as we can go, we are hitting Florida. As we talked about during our last podcast, they had such a successful advocacy day. And while I don't have a huge update to give you guys about Florida, I just wanted to say again how wonderful that advocacy day was and how it really just kicked off the advocacy season. I think Florida always has a great turnout, and it's just wonderful to see everyone show up and really get involved so early in the year. And advocates also met directly with Agency for Healthcare Administration to discuss authorization challenges and ways to streamline processes for medically fragile children and adults. The energy was high and the engagement was strong. And that's what's important, y'all. That was funny. But I just wanted you guys to know that really kicked us off. And I think if you're an advocate in Florida, you should be proud. While there's not these big headlines going on like we see in other parts of our country, it's important that this momentum keeps going because you never know when something may come about. An advocacy opportunity will come, and we need full-blown momentum. And you guys have already got it. So great job there. And moving to North Carolina, so North Carolina remains the only state in our entire country without a finalized 2025 to 2027 budget. That encompasses 3 years right there. The only country in our entire nation. I just wanted to reiterate that again. That uncertainty is creating a lot of risk, not just for Medicaid funding, but for healthcare access and broader state operations. So it's not just home care, it's not just hospice, it's everybody. Anyone included in the budget is like, what do we do? How do we move forward? You know, we're based off of a budget in 24. Like that's feels like eternity ago. So the added tension, also another update from North Carolina. We talk a lot about legislators and transition and elections coming up and all these things, but we also haven't talked about some of the positions that lie under that change and can also change policy. So the Medicaid director, Jay Ludlam, has departed from North Carolina Medicaid, and Malene Bush is now serving as interim deputy secretary. So due to the leadership change during a budget year, only heightens the need for strong, consistent advocacy. We don't exactly know what her priorities are going to be yet during her time as deputy secretary, so that'll definitely be something interesting to watch. And you definitely, when these things happen, you want to meet with them. You want to make sure there's a connection there. It's important to meet with individuals within Medicaid as much as it's important to meet with legislators. They all have to work together, and we hope that they understand how important and influential home care and hospice is to our communities. Also important for advocates to know, Advocacy Day in North Carolina is coming up on May 13th in Raleigh. This is going to be a co-hosted event between Hearts for Home Care, the Association for Home and Hospice Care, along with Simber Care, and we've always had a great partnership, so I think it's going to be a wonderful day, and we hope you guys can come out. All right, everyone. Today, I wanted to have just a special session to talk about something very important coming up in the month of March. So I'm going to call this session the most powerful advocacy tool you have, and that is your vote. Voting coming up in March for the primary. I know you hear this from like every resource, but your vote counts, and it is very important. And when it comes to advocacy, we can talk about meetings, we can talk about sharing your story, and while all of that is so important, this is the number one thing. This is going to determine, longevity. This is going to determine who's sitting in office, whose connections you're going to have, who you're going to be meeting with. It's very important to look at it, and even voting on the local level. A lot of times we're talking on this podcast about state legislators or federal government officials. All those individuals, of course, are important, but it really all starts at the local level, looking at who your candidates are for your county commissioners, looking at mayor, all those little things are part of this big movement, right? So please, 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 if you can, every state has a different day of voting. I know early voting is going on, I believe, for most of the country right now. But please, if you can, go early vote, go on the day of, go when you can. But most importantly, please go and cast your vote. And it's always important to know who your candidates are. Before you go online. There's a lot of resources. You can get a sample ballot. We don't pressure which candidate you pick. We don't care where you go or where you fall. The most important thing is you do go and you get out to vote. So I know I'm going, I early voted, but I just wanted to give you guys this little segment just as a reminder and just to say that you can call yourself an advocate even if all you do is get out to vote, because that's the most important. So awesome. Thank you guys. All right. Thank you guys so much for coming back to our podcast today and hearing all of our updates. While we may have not covered absolutely every state or absolutely every headline, I hope that we hit the highlights today and gave you guys an opportunity to know more about how to advocate, how to get out there and vote, and how to stay prepared for all the things that are coming up. So thank you so much, and check out our website for any upcoming events and activities that you can get involved in, and I look forward to seeing you next time.